All right, this is Dr. Abbasi, and I am giving you a quick orientation to the Canvas course for the Fall 2020 Psychiatry Clerkship. If you click on the course, you should get to this home page where you will see a really nice photo, and then you will see a description of the clerkship, including clerkship objectives. And then I have the most important things you need to be aware of linked over here. And the way I'm going to do this video is I'm going to have you first look at the most important information, and then I'll get to some of the more nuances of how to navigate this page. So the first thing, very important, that I want you to do is click Getting Started. So this will take you to the Getting Started page, which will give you a step-by-step of things you want to review before you start the clerkship on Monday. So the first thing you need to do is actually watch this orientation video, which would be available here, but I'm making it, so it's not on this video. Otherwise, the next thing you'll be doing is watching a required video about patient safety and therapeutic communication, along with a quiz that is following it. This is something that all students must complete. It is required. Patient safety and personal safety of the students is extremely important, especially on this unit. And this will give you important tips and techniques. And I know we went over some of that in diagnostic medicine, but that was quite a while ago. So this is supposed to give you a refresher and kind of make sure that you're on top of things on the inpatient unit. So be aware this is important and required. I will be asking you about it if I don't see it completed by Monday or Tuesday. So you want to do it in the first 2 days at least of the clerkship. The second thing, or the third thing, I guess, that you should be aware of is the calendar of events that will happen for the next 3 weeks. So other than the clinical things that you're going to be doing, there is the other assessments component of your clerkship, which comprises about 20% of your clerkship grade. So you need to be aware of things that are due that are other assessments. Week 1, 2, and 3 will each have a quiz on the Friday of that week. I'm aiming for 3 p.m., but I will update you on Monday about exactly what time it will happen because I have to coordinate that with your site physicians. I really don't want to cut into your clinical time, but I also don't want to ruin your Friday. So I'm trying to figure out what will be the most appropriate time. So you'll have more information on that shortly. Each week quiz will cover specific disorders. So when you are studying for them, do not feel like you have to read all of psychiatry. I would just simply review disorders mentioned here. Okay? This is not a comprehensive list. So these quizzes are not made to just get you completely ready for the shelf exam. Of course, you need to study on top of that. They will be written in an NBME format with a clinical vignette, and the focus will be on understanding how to diagnose the patient, like coming up with the appropriate diagnosis, using the clinical vignette, and also treatment. So those are the two things that will be primarily focused on here. We will not be having any epidemiology questions, so you don't have to worry about knowing the point prevalence or lifetime prevalence of each of these disorders. That's not usually what the NBME tests on. That's not what I'm testing you on the quizzes. The other things you should be aware of are the assignments due. So evidence-based medicine, a PICO worksheet will be due on Wednesday of your second week. And then the case write-up will be due Friday of the last week. This is very important. Please keep watching this video because I will go over this with you. You really need to make sure you're on top of this. It's not an easy task. This calendar is accessible from this page at all times, so if you need to look back at it, you can. If you want a brief description of what a typical day will look like on each of these rotation sites, I asked the chief residents to provide a breakdown of a typical day. I would not hold them to it because obviously it's a hospital and things might change, but keep in mind this is what your typical day may look like. So if you click on any of these, it will give you an explanation of a typical day. Finally, the fifth thing on this list, this is not required but highly recommended. It is a video that's about 34 minutes long, so it's a little lengthy, and you can speed it up if you need to. But it talks about the medical, legal, and ethical aspects of the inpatient psychiatric unit. If you are watching this video after having done a clerkship rotation on a medical surgical floor, just be aware that this is different. So the inpatient psychiatric unit has very particular rules and nuances, and there's a lot of legal issues that are very different than what you have seen on the inpatient medical surgical floor. So I really encourage you to watch this. This is not going to be required, so I'm not going to sit here and monitor you. but I really recommend it. It will catch you way up to speed, especially when it comes to treatment team meetings. You'll understand a lot more if you watch this video. All right. If you go back to the home page, you can see you have access to your EBM PICO sheet and the case write-up. Here you will also have the due dates listed on the home page of each of those things, the case write-up and the PICO sheet. This is my version of it, so I can see the quizzes and when they're going to occur. That won't be on your view because I have to publish the quiz for you to see it, which I won't publish until the day of. But I will remind you that you have to make time for the quiz. So you have the EBM PICO sheet, the case write-up. This date is incorrect, so it'll be due on Friday, actually, of October 14th. If you click on case write-up, that's the next most important thing. It will take you to the description of the case write-up. Be aware the case write-up is worth 60 points. Your entire other assessments, quote-unquote, category is worth 20% of your grade. And the whole, or the amount of points total you can get for other assessments is 100 points. So case write-up makes up 60 points, which makes up about 12% of your final clerkship score. So you can imagine this is a very important thing for you to be aware of. Again, these dates I have to correct because they were made for when you had 4 weeks of rotation time, which you do not have anymore. So make sure that you review the details and instructions of how to do your case write-up. Understand that you want to review these and print these out so that you know exactly what you need to be asking of your patient, because they will not be similar to a typical intake note, which may be very abbreviated from the team that you're rounding with. So let them know that this is something you have to do and ask some of these additional questions from your patient. If you want to know how I'm going to be grading it, you can click here. This is for transparency purposes. You should be able to see what the grade looks like, or what the components of the grade look like, how many points each section is worth, and the total points will be at the bottom, so 60 points. All of these are basically going to be determined by whether or not you included each component. The only thing that might be a little subjective is the differential diagnosis, formulation, and treatment, which is supposed to be that you've put some substantial effort into it, and we should be able to tell based on how you write it out. And again, this really tells you how to format it when you write out each component. Very important to keep in mind, these headings are in bold, must be in your case write-up, and the appropriate medical history needs to be under the appropriate heading. So even if you are using a note you wrote for the rotation and it doesn't have these headings, you need to move it to the appropriate heading. If you have the medical information somewhere but it's in the wrong heading, you will not get points for it. So if you throw social history randomly in past medical history, you will not get points for that. They have to be under the right heading. So this is really holding you to the idea of organizing your thoughts and presenting them appropriately. That's it for this. Again, very important that you review this. I would print out the rubric and start thinking about cases now. Do not wait until the rotation ends to start thinking about your case write-up. Even though it's due on the Friday of the last week, it's really important for you to make sure you review that, or review the information. The EBM PICO sheet is easier. It is simply a single sheet, and what you are doing is hold on, I'm just waiting for load. What you're doing is you're basically identifying a question, and this could be anything, something your attending brought up, whatever, looking up the answer for that question, making up a PICO for it, and then kind of showing your results. That's it. You've done a bunch of these already. This shouldn't be too difficult. This is worth 10 points of your grade. If you you submit it late, you lose all 10 points. However, if you are missing the deadline for this, you still have to submit it. If you do not submit the PICO worksheet, you'll be considered incomplete for the clerkship, so your grade will be incomplete. So you want to make sure you are submitting the PICO worksheet on time altogether as well. You can't just avoid it. So make sure you're aware of that. Again, I'm sorry about these dates. They will be changed to reflect the appropriate dates. Follow dates on the home page. Again, if you go to the bottom, you should see the due dates for each of these things. Those are the appropriate dates. Oh, you know what? This is supposed to be Friday too. Oh boy. So I'll switch these, but they will be updated to the appropriate dates. Ugh. All right. Otherwise, you have your recommended textbooks, your additional learning resources, and your clinical tools. I highly encourage you to look at each of these. The recommended books will link to the books. If you click on them, they'll go through the library portal, and these are all ebooks that are available to you. The additional learning resources are a few, but the memorable psychopharmacology videos are useful for memorizing mechanisms of action. Mnemonics in a Nutshell is a very useful article that talks about different mnemonics to memorize the symptom criteria for psychiatric disorder. And then Psychiatry Online is like the Bible for psychiatry, where you have all the resources and everything you need in that link. I think those are the main things. Clerkship syllabus you can download. Meet Your Instructors will not be active by the time you see this video because unfortunately we had a site change, so I'm still updating all the instructor profiles and everything. So that's going to take a minute. Otherwise, you have your student handbook, and I really recommend Clinical Tools. So here you will have your psychiatric intake note, your mental status exam guide. I really recommend you download both of those prior to going to the clerkship and also print them out. You will also have several scales here that you can use to assess patients. And again, if you click on them, they'll download and then you can print them out easily. So I wanted to keep everything in one place so it would be easy for you to access some of these tools. That should be it for the overview. If you look on the right part of your screen, you can see this tells you all the components and how much each component makes up your final score. Otherwise, that is basically it. If you have any questions or any concerns after watching this video, please let me know. If there's any dead links or things that are inconsistent for some reason, please let me know. I just found a few of them already when I'm talking on this video. So please don't hesitate to email me and notify me that something is either not working or it's saying one thing in one place and saying something different in another. Otherwise, I hope you have a very enjoyable experience on your psychiatry clerkship, and I wish you the best of luck, and I hope you do well. All right, take care.